Do you freak out when your child gets that high-grade fever and keep chasing the numbers on the thermometer? Hi, I'm Dr. Sushanta I, pediatrician and a mommy of 2 toddlers. And today I'm going to share with you some do's and don'ts that I follow as a pediatrician mom when my children get that fever. So let me share with you some incy-wincy physiology of fever. Like our home, body also has a thermostat. So whenever there is an infection or an inflammation process in the body, infection markers like interleukins, cytokines which are released. These markers play a role in managing the immune response of the body and regulating the thermostat. So what happens with this? The fever reaches its peak, and once the thermostat is regulated, the fever starts coming down. Do you know increase in temperature makes the immune response of the body more effective? Also, the rise in temperature makes the body environment less friendly for the bacteria or the viruses to thrive in. So we realize fever is not that bad after all. When my children get fever, my aim is to give maximum comfort to my children and not just rush down with the numbers on the thermometer. Of course, I need to evaluate the underlying cause of the fever and address the underlying issue. Putting across facts regarding 2 important concerns when it comes to high-grade fever. Number 1, high-grade fever, can it cause febrile seizure in my child if the fever is not brought down immediately? And number 2, whether high-grade fever can cause brain damage in the child. So let's first address the first concern. Febrile seizure is seen commonly in the age group of 6 months to 5 years of age. A child who has a tendency to have a febrile seizure can have that seizure even if the fever is as low as 99 Fahrenheit. It need not reach 104 Fahrenheit. Even at 104, 105 fever, child who does not have a tendency for febrile seizure will not throw a seizure. This tendency can be due to genetic, or it could be due to any underlying cause which may not be detected. Let's address the second concern. So parents, let's understand. For brain damage to occur because of fever, temperature has to be as high as 107 Fahrenheit. And 107 Fahrenheit fever, we don't get in any infection or inflammatory process causing fever. 107 Fahrenheit fever we can get only if the environmental temperature has risen, and that can happen due to burns or some severe heat stroke. So let me share with you 4 red flags when it comes to fever. Fever in a child which is less than 3 months of age, or fever in a child of any age with underlying conditions like maybe heart condition, cancer, or a prolonged steroid therapy that has suppressed the immunity in the child. Point number 2, persistent fever which is lasting more than 3 to 5 days in a child. Point number 3, fever which has caused altered consciousness of the child. Child is feeling excessively tired, sleepy, or inconsolable cry. And point number 4 is your mommy instinct that something is wrong with the child. So here are 5 things I do and don't do as a pediatrician mom when my children get that fever. Point number 1, I don't use ice packs or cold sponges in my children when they have that high-grade fever. It's not even recommended by pediatric guidelines. What happens when you use ice packs? It just disturbs the body's thermostat. Most importantly, it makes my children very uncomfortable, makes them shiver, and instead of doing good, it does more harm as it can in return rise up the temperature further. Instead, what I do is increase the speed of the fan, cool down the AC to 26 degrees, let the environment cool down. As the environment is cooled down, body's temperature would also fall down, but slowly and gradually. Point number 2, I don't give antibiotics in every fever, even if it is a high-grade fever. Fever is not a sign of antibiotic deficiency. Most of these fevers are viral in nature and do not require antibiotic to treat it. Point number 3, I don't wake up my children in the middle of the night to measure their temperature or to medicate them for fever. Good sleep is very important for body's healing and recovery, and I want my children to get that good sleep. If they are breathing okay, not complaining of any pain, I let them just rest it out. If they are uncomfortable with any pain or high-grade fever, they are going to wake up, and that's when I do the needful. Point number 4, I don't overdress my children with layers of clothes and blankets and sweaters when they have that high-grade fever. When we overdress children, what happens is the body's heat is retained inside, causing further rise in temperature. Instead, I dress them up in loose cotton home clothes and have a simple cotton bedsheet pulled over them. A little fact to share with you. Shivering that we see in some fevers is not because of the external environment. It's mainly because of the chemicals which are generated inside the body that is causing this shivering. And no matter how much clothes you put over the body or sweaters and blankets, that's not going to make the body warm. Point number 5. I don't send my children to school within 24 hours of the fever onset, because that's the time when this infection is at its peak, and as a pediatrician mom, I have to do my best to prevent the spread of germs from one child to another. As a pediatrician mom, my aim when my children have fever is to give them maximum comfort and not just chase the numbers on the thermometer. Focusing on their hydration with fluids and juices, keeping them in comfortable cotton clothes, cooling the environment in which they are resting, giving them a good sleep, and being patient with their recovery goes a long way in their fever treatment rather than just escalating the medication. If you find my video useful, do share your love and like, share and subscribe to my channel. Happy parenting and happy cuddling.